Hello and welcome back to my channel. Today we are going to learn about typhoid. What is typhoid? Typhoid is an infection which spreads in our body through the contaminated food and water which we intake. Basically it is contaminated. Why we are saying that it is contaminated? Because it has bacteria which is called as Salmonella typhi. Salmonella typhi is a gram-negative bacteria. Why we call it as a gram-negative bacteria? Because it has thin peptidoglycan layer. Okay, it is a gram-negative bacteria that we need to understand. Now, basically तीन तरीके की diseases होती है like pandemic, epidemic and endemic. So it is a type of epidemic disease. We need to understand what is epidemic. Epidemic means, what is epidemic? It is a rapid spread of a disease. We can say that it is a rapid spread of a disease to a large scale, okay, in a very short interval of time. We can write it as rapid spread of a disease to a large scale in a very short interval of time. Okay, so typhoid comes under the heading of epidemic disease. Okay, now we'll see that what antigens this bacteria has on itself. Antigens we'll see. It has O, it has H and VI antigen. What O stands for? O stands for somatic. H stands for flagellar and VI stands for virulence. Okay, so these are the three antigens which are present on this bacteria Salmonella typhi. Okay, now what is the route through which it spreads in our body? Route we'll see. Basically it spreads through the feco-oral route. जो फीको ओरल रूट होती है उससे ये स्प्रेड होता है. इसमें एंटीजन्स होते हैं ओ एच वी आई एंटीजन. ओ जो होता है इट मीन्स सोमैटिक, एच मीन्स फ्लैजेलर एंड वी आई स्टैंड्स फॉर वायरुलेसेंस. एपिडेमिक डिसीज़ है बिकॉज ये बहुत ही लार्ज स्केल पे अफेक्ट कर सकती है बहुत ही कम समय में. ठीक है, मेन कॉज क्या है? बाय द कंटामिनेटेड फूड एंड वाटर which we intake because it is infected or it has the bacteria called as Salmonella typhi, which is a gram-negative bacteria as it has a thin peptidoglycan layer on itself. So we'll see the incubation period. Incubation period इसका कितना होता है? इसका incubation period होता है 2 से 14 दिन तक, 2 to 14 days. Okay, we should understand that 14 days के ऊपर क्या होता है कि ये क्या करता है, ये हमारे शरीर में प्रोलिफरेटिव स्टेज पे पहुंच जाता है. प्रोलिफरेटिव का मतलब क्या होता है कि ये जाएगा आपके स्मॉल इंटेस्टाइन में. ठीक है, सपोजिटली मैं यहाँ से बना रही हूँ स्टमक से आपका एलिमेंट्री कैनाल. ठीक है, दिस this area, suppose this area, okay, we can say that this is the area of small intestine. okay, तो ये यहाँ क्या करती है, यहाँ पे ये प्रोलिफरेटिव स्टेज में आती है और ये आपका क्या करती है, ये फॉर्म्स अल्सर, यहाँ पे अल्सर बनाती है. ठीक है, ये एक चीज़ आपको पता होनी चाहिए. now we'll see the sign and symptoms. क्या साइन और सिम्टम्स इसके आते हैं? वील सी दैट फर्स्ट वीक में क्या साइन और सिम्टम आता है. फर्स्ट वीक में आपको फीवर लगेगा. ओके. सेकेंड थिंग इज़ द हेडेक. थर्ड is your nausea. Fourth is your vomiting. And fifth is the abdominal pain. Special sign that you will see is relative bradycardia. Okay. You know that we have the crypts. Okay. Crypts will get irritated and it may cause diarrhea, pea soup diarrhea. Okay, pea soup like diarrhea. Now second week, what we'll see in the second week, rose spot, or we can say rashes. ओके. ये रैशेस हमें कहाँ देखने को मिलेंगे? ये हमें देखने को मिलेंगे थोरैक्स के रीजन में और एब्डोमेन के एरिया में. लाइक वी कैन से द प्रॉपर एरिया चेस्ट पर आपको ये चीज़ दिखेगी. ओके. नाउ स्प्लीनोमेगैली. स्प्लीन की साइज़ बड़ी हो जाएगी, स्प्लीनोमेगैली दिखेगी आपको. थर्ड साइन दैट यू विल सी इज़ द abdominal distension. Okay, this you will see. Now third week, we'll see what happens in the third week. थर्ड वीक में क्या होता है? थर्ड वीक में आपको साइंस मिलेंगे लाइक मेलेना. व्हाट इज़ मेलेना? ब्लैक कलर्ड स्टूल. ब्लैक कलर स्टूल को क्या बोलते हैं? मेलेना बोलते हैं. नाउ हेमोरेज. यू विल सी हेमोरेज. ओके. नाउ वी विल सी द डायग्नोसिस. व्हाट इज़ द डायग्नोसिस? सी, फर्स्ट थिंग विच वी विल डू इज़ द ब्लड कल्चर. We'll see that the WBC count becomes less. We will get leukopenia. So to know this thing, we will perform the Vidal test, blood Vidal test. Okay. We'll also see that there will be an increase in the antibody number. Means the antibody count will increase with time. Like second week में थोड़ा रहेगा, you know, then third week में और ज़्यादा हो जाएगा. Now, what other test we can perform is like typhoid.m test. Typhoid.m test. Okay. Other thing which we will see, the other diagnosis which we can make is by Tubex test. Okay. So these are the few points which we have covered in the diagnosis. Now we'll see the treatment part, which is the pharma. Okay, yeah, we can say that it is a pharmacology part. Okay, what things we'll see here? See, the first thing, so fluoroquinolones, like ofloxacin, levofloxacin, ciprofloxacin, and moxifloxacin. This is the fourth generation. Generally, nowadays, we give this fourth generation fluoroquinolones. Okay? These are the few names. Now, these are the medicines which we can give to a patient which is suffering from typhoid with the recommendation of the dose. Okay? Now, azithromycin also is given. Like approx 7 days. Okay? Orally what we can give? Orally, Typhoid oral. For you can give this, and for injectables, VI polysaccharide vaccine is given. Okay.